Aging meeting. First of all, Jean Wollerman is not here today. Her mother-in-law passed away the other day, and I believe the funeral is today. So a card is being sent, condolence messages. Bobby, would you call the roll, please?
Sue Ashton.
Here.
Peggy Bellin.
Here.
Claude Benedict.
Here.
Lurton Blassingame. Ron Durkop.
Here.
Sandy Kleckel.
Here.
Julie Maslowski.
Here.
Judy Ritchie.
Here.
Deb Allison Osby.
Here.
Okay, thank you. The minutes from last month's meeting have been distributed to everyone. Are there any additions or corrections? If not, I'll take a motion to approve.
I'll make a motion to approve.
Second, please.
Second?
Okay. The minutes, any objections? All those in favor?
Aye.
Opposed? Okay. And citizen statements, we have no one here today, so moving forward, new business. Ron, would you like to introduce our speakers, please?
Sure. It's my privilege to introduce Beth Culp, who's the Director of the Long-Term Support Division at our Winnebago County Department of Human Services. And also with her today is Becca Grollo, who is the new Winnebago County Dementia Specialist. And we're excited about that new position. We've been talking about that from time to time on this committee. And so we're going to hear from both of them today on the Dementia Specialist position and all the exciting things that are going on surrounding that new work.
Good morning. And you can use the podium, or for right now, you can pull the microphone around in front of you.
Okay. Should I stand or does it matter?
It's whatever
you're
Whatever. Okay.
Whatever works best for you.
I'll sit for right now, and then if I need to stand, I'll stand.
Okay, would you pull the microphone a little closer to you because you're being taped also?
Like that?
Good.
Mm-hmm. All right, so my PowerPoint goes over kind of the dementia care specialist position statewide, kind of what our mission is, our goals, and then kind of goes into some statistics. And then towards the end kind of goes over specifically what I'm working on in Winnebago County. So for the mission for the dementia care specialist position, it's is to support people with dementia and their caregivers in order to ensure the highest quality of life possible while living at home. There's 4 goals for the dementia care specialist position, and that is to provide free information and assistance to adults with memory or cognitive concerns or who have been given a dementia diagnosis. So by doing that, we're going to help them maintain their independence in their home. Our goal is to hopefully keep them in their homes as long as possible, and supporting that caregiver so that they can, care for them as long as possible. The second goal is to provide information and support to family members and friends who are caregivers, such as support groups and respite care. The third goal is to help develop dementia-friendly communities where people with dementia can remain active and safe and caregivers can feel supported. Dementia-friendly communities include memory cafes, businesses being dementia-friendly, so getting the Purple Angel, which is training that businesses seek out from hopefully me and some other community members. And that's a 30 to 40 minute training at the business. They have to have 50% of their staff at that training. They have to have their management staff at the training. They also have to have a key person that I keep in contact with to, give them the materials so that they can train anybody coming in that's a new hire, and then also just having that collaboration with me to make sure, okay, we've had a huge turnover, can you come in and do the training again, or kind of meet with them, talk with them annually to see if we can continue doing that training moving forward. And then dementia coalitions. I started kind of having a meeting last month with a group of, I think, 3 or 4 people, and that was just to start it. I had some other businesses in the area, memory facilities that were involved. I'm hoping to expand that this coming, I think, next week or the week after. To hopefully some community members, have the police department involved, and start that coalition and seeing what Winnebago County needs as far as being dementia friendly. And then public presentations and meetings. So me going out to, whoever kind of wants to learn more about dementia, telling them about my position, making it more wide known, like today. And then just keeping up with the meetings as far as like memory cafe meetings, the coalitions and stuff like that, so things keep going and we're moving in the right direction. Then the 4th goal is to train other staff at the ADRCs and other county and municipal offices to be dementia capable. So right now, Beth and I are working on getting everybody trained within our county building. So yesterday I did kind of a presentation with Human Services and moving forward with the ADR, and I trained our ADRC staff, or not trained, but told them about the dementia care specialist position, but continuing to let people know about my position and then training them on the dementia diagnosis. This is a map of the dementia care specialists that we're covering in the counties in Wisconsin. So there's 21 dementia care specialists working in ADRCs covering 34 counties. There are 3 tribes that you can kind of see on the map. It's 3 green little areas. And then the purple are the DCS positions. So there are 5 DCS positions serving more than 1 county. Okay. Some facts and figures. So the number of Americans living with Alzheimer's is growing and growing fast. An estimated of 5.7 million Americans of all ages have Alzheimer's. An estimated 5.7 million Americans of all ages are living with Alzheimer's in 2018. This number includes an estimated 5.5 million age 65 and older and approximately 200,000 individuals under age 65 who have younger onset Alzheimer's. So 1 in 10 people age 65 and older has Alzheimer's dementia. Alzheimer's disease leads to nerve cell death and tissue loss throughout the brain. Over time, the brain shrinks dramatically, affecting nearly all its functions. So when I did this presentation before, that was kind of a question was, what's the difference between dementia and Alzheimer's? Alzheimer's is a form of dementia, and it's the main one that is causing death amongst the dementia diagnosis, and that's because the brain is shrinking and you lose kind of all your functions, and eventually death is the end result for that one. And scientists are not absolutely sure what causes the cell death or tissue loss in Alzheimer's, but they see plaques and tangles, and that's kind of what they're guessing is the cause of the cell death. So almost 2/3 of Americans with Alzheimer's are women. Older African Americans are about 2 times as likely to have Alzheimer's or other dementias as older whites. Hispanics are about 1 1/2 times as likely to have Alzheimer's or other dementias as older whites. As the number of older Americans grows rapidly, so too will the number of new and existing cases of Alzheimer's. Today, someone in the United States develops Alzheimer's every 65 seconds. By mid-century, someone in the United States will develop the disease every 33 seconds. This I got from Susan McFadden. She did a presentation in Juneau, and she did kind of a map of Dodge County when she did her presentation. So she sent this to me for Winnebago County, and this is kind of looking at what our numbers would be if you're looking at that 4% of our population having that dementia diagnosis. So, between ages 40 and 64, 2,263 in Winnebago County would have that dementia diagnosis or Alzheimer's diagnosis. And then moving forward, you have the 65 to 74, that's 1,450, and then so on and so forth. So that's kind of, if you're looking at that 4%, having that and, kind of multiplying that, that's our numbers for Winnebago County. And that's people who are diagnosed. There's probably a lot more out there that aren't even diagnosed that we don't even know about. And then for Winnebago County, what I've kind of been working on. So the first thing that we worked on was getting a brochure so that when I meet with businesses and different groups in the community, I have something to give them so they know how to contact me and kind of what my role is and what we're working on. So we kind of developed, there were other brochures already out there with other dementias care specialists in the state. So we kind of collaborated and, made it our own. So we have a brochure, and I can kind of pass that around so you guys can see. And then within that, a brochure and kind of what I'll be working on, some evidence-based programs is the LEAPS program. I'm hoping to get up and running. That's LEAP stands for Language Enriched Exercise Plus Socialization. So that's a volunteer-based program where you pair up the volunteer with the person with the dementia diagnosis or cognitive deficits. And that volunteer either goes out to their home or brings them out into the community and kind of gets them to socialize, and then also helping them with exercises within their home. So I am working with, I have a meeting with, I think, Julie at AdvoCap to they already kind of have a senior volunteer program, but it's not dementia specific. So meeting with her to get some volunteers trained specifically on the dementia diagnosis, and hopefully getting them involved with and getting them paired up with people out in the community.
And Becca was talking about some of the physical effects of the brain for someone who's diagnosed with Alzheimer's. There's been a lot more research from actual scientists and the medical professionals to show that exercise, at the very least, prolongs the diagnosis. And for people who've already been diagnosed, exercise helps diminish some of the effects of dementia. People have thought about that for a long time and had seen some anecdotal things and felt that way, but there's now research-based studies that have shown that exercise truly does have a very big impact. So if someone's 25 and they're listening to this presentation, they might think, I don't know anybody with dementia, or I don't have dementia. You can do something at age 25 to help yourself, if nothing else. So when Becca's talking about getting the word out to our community and educating all educational levels, all age levels, it is really important. And we want people to really understand that it impacts everybody, whether you know somebody or whether you have it. You may very well know someone or has someone or have it, and there are ways to diminish, again, the symptoms and or prolong the diagnosis. So it's been really interesting.
And then another evidence-based program is the DICE program. That is something that we're looking at getting trained on. A few members in the ADRC who are interested, along with myself. And that's kind of this step-by-step method used to help manage and understand behaviors in the person that's diagnosed with the dementia diagnosis. So it kind of walks through. So the D stands for describe. You're describing the behavior, when it's happening, kind of getting the details of maybe why it's happening. And then you're investigating. So, okay, it's happening at this time every day. It's always in the living room, kind of investigating all the details, and then creating a solution. So you're creating something, is it always at nighttime when maybe there's a lot of noise outside, or there's not a lot of lights on, kind of creating a solution of maybe we need to turn more lights on and make the hallway more visible, moving things around, and then evaluating how doing those things help. So did turning the lights on and moving the furniture to make more of a clear path, did that help with that behavior? If it didn't, then you're going back to, describing that behavior and then going through those steps. So I would be working with the caregiver in their home to go through these steps so that eventually when they're on their own and maybe a new behavior arises, they can kind of go through this process on their own and hopefully help with that caregiver stress and that burden to care for them longer in their home. So this is kind of this is the book. It goes through the different steps. This is what you would give the member in their home, and then it kind of explains dementia and the different behaviors and different approaches. So it's very useful. So when we were at a meeting, they had given an example of a behavior. So this lady was it sounded like at a facility, and she was crying and very upset and kind of yelling out and very repetitive. And when the caregiver came up to her, asked her what was wrong, she's like, that lady over there she's just very upset and she's very worried, and you need to go and help her. You need to go and help her. And finally, when they sat down kind of with this approach and looked at everything and all the different angles, they found out that there was a mirror on the wall. And the lady was seeing herself in the mirror all upset, crying, and frustrated. And so what they did is they took that mirror down and the behaviors went away. So it's kind of, giving that, looking at all of the different aspects, and instead of giving that person a medication and kind of snowing them, it was looking at something so simple as taking the mirror off the wall, and then she was fine. So that's kind of an example. Powerful tools for caregivers. That is something that I'm working with the health department with. We're hoping to start that next in spring. We have to have some training for that. Also, we need some respite care because it sounded like when they've had it in the past, the issue was a lot of caregivers wanted to do it, but they didn't have anybody to watch their loved ones while they were doing this 6-week program. So they would come in, do this 6-week program, and it's a self-care education program, helping them with their stress and their burden at home, making sure that they're taking care of themselves, they're exercising, so that they can care for their loved one longer in their home. And the 6 kind of different topics that they go over is, taking care of you, identifying and reducing personal stress, communicating feelings, needs, and concerns, communicating in challenging situations, learning from our emotions, and mastering caregiving decisions. So that's what they go over in that 6-week course. Then memory cafes. So we have 4 memory cafes in Winnebago County. We have the YMCA on 20th, Oshkosh Library, the Neenah Library, and the Menasha Library. So my goal with working with that is I'm going to be kind of taking over the Oshkosh Library, facilitating that memory cafe, or helping with that, and also kind of getting out there what the themes of the memory cafes. So Fox Valley Memory Project kind of took over the Neenah and Menasha and kind of advertised that one and tell what the themes are that, but we don't have anything kind of advertising the 20th and the Oshkosh Library. So kind of posting that on our website, handing out flyers to say, this is what's coming up in the next month. These are the themes. Because from what I'm hearing from the members that attend is, you've got some members that like the music and you got some members that like the crafts, but they might not like everything. So when they get there, it's like, oh, we're doing another craft. Like, it doesn't hold their attention. It's not successful for them. So it's kind of not necessarily a waste of their time, but it would be better if they knew coming in what the theme of the memory cafe is. So we're just working with that. We have a committee that is going to be meeting to kind of go over, okay, these are our themes, to make sure that we're not doubling up either. So that if the 20th Y has, for instance, for this month, they're doing kind of a military theme. We're not going to do that at the Oshkosh Library the next week. kind of changing it up because a lot of the members go to every single memory cafe. So if it's the same, it's kind of repetitive. Then the Purple Angel. So working on that, I had a committee meet for that last month, and we got a brochure started to hand out to the businesses just to explain what the Purple Angel is, what they need, the 50%, the management, kind of what I was telling you before, and who to contact if they want to get Purple Angel. And we're meeting again this month to kind of go over a list. So I've created a list of kind of businesses that I think would be key businesses to start out with, and then hopefully word spreads and people start contacting me to get trained in the Purple Angel. And then once they're trained, they receive a Purple Angel decal outside their window so that the members in the community would know, okay, they've been trained and they know how to handle a situation if something were to happen when they're shopping. Events that we're working on in Winnebago County, steering into the skid is something we are hoping to bring December 18th. That was the date that they had available. So we are just working on a few little glitches as far as getting a place for that to be held, but that is a play that a man and a woman, they act as a husband and wife in a vehicle. And they go over the process of the husband getting the dementia diagnosis. So you ride along with them in the car and you see, that at first he does not have any signs of dementia, but then all of a sudden he starts having signs, and then kind of going through that whole process and their struggles and everything. So I've heard it's a great play. We haven't had it in this area, so hopefully that we'll have a good outcome for that December 18th, but we're hoping to do an afternoon showing and then an evening showing, and it's free to the community. And then food would be provided.
You say where that?
That'll draw them in.
We're trying to figure out where it's going to be. We've had a couple different places, but either they're booked or, so we're maybe going to have one showing at Myron, and then one showing at a high school in Oshkosh. So we're trying to pinpoint down where we can have it. Dementia Live, we are possibly going to be bringing in as far as like training. It's kind of like your virtual dementia tour. So I would be trained in that to be able to then hopefully bring that out into the community to train businesses if they want me to train specifically in the business itself. And then Marty Schreiber will be coming to Oshkosh April 29th. And that is set in stone. That's going to be at the Alumni Center in Oshkosh, the UW Alumni Center. And that's hopefully we're kind of looking at it being not just Marty Schreiber speaking, but also having the Alzheimer's Association speaking on dementia kind of education. And then I would be speaking for Winnebago County in the DCS position. And then we also kind of did a little update on the ADRC website. So before, when you were going on the ADRC website, there are kind of tabs on the side. And there wasn't a specific Alzheimer's or dementia tab. It was, I don't know what the tabs were before, but you had to click under several different tabs to find Alzheimer's information. So it wasn't user-friendly for somebody that maybe doesn't really know how to use the computer. And, once you search and you're like, oh, I can't find it, you kind of give up. So now it's plain as day. You see Alzheimer's and dementia on the side, you click on it, and all your resources are right there. And along with the resources, we created kind of a tab that when you click on it, it's a PDF file of just one piece of paper handout that gives everything for Winnebago County. So it starts out with your memory cafes, your lyrics and laughter, and it goes into the respite in Neenah, goes into the caregiver support groups, and it just has it on one page. That's what the senior center told me that they wanted, something that they can just hand out and say, this is what we have here in Winnebago County to offer. So I created that, hand those out, but then also have it on the website. So if somebody wants to print it off, they can print it off and put it on their fridge. And then along with the respite care, that is in Neenah. That's a free respite service at St. Paul on Commercial across from the Y. And it's from 1 to 3 on the first and second Monday of the month. And we're hoping to bring that here in Oshkosh, or actually we're going to be bringing it here in Oshkosh.
Maybe this month even.
Yeah, we have it confirmed. We have a church that's wanting to do it. We have a space. We are just waiting for volunteers and some furniture, and then would be providing that also here in Oshkosh. So a free respite that they can bring their loved one to, so that they can go home, get some stuff done at home, or go grocery shopping, go to the bank, do something within those few hours, so that gives them a little break and it's not a financial burden.
One of the things that's nice about it is some people don't like to associate with the government, and so we're located in a government building, and it can be a barrier for some people, and filling out paperwork or financial information can also be a barrier. So with these respite locations, there is one page that the caregiver would fill out based on their medical information, things you would need to know about their medical status, because Valley VNA has a CNA there for these just in case. But otherwise, there is no paperwork and financial stuff, and you just sign up and bring your loved one there. So I think that's one of the things people can draw people in, is that it's not looked at as a government program that people might or might not want to avoid. So there's an advantage with that.
I would comment that I have heard people talk about this, and they are so looking forward to it.
The respite care?
Yes.
Yes.
In Oshkosh.
Yes. We have, I've had a few people come up at the memory cafes and say, oh, it'd be great to have it in Oshkosh, because they go to the one in Neenah. They don't mind traveling, but, their specific thing was, when I get to Neenah and it was only 2 hours long, it's like by the time you get to Neenah, drop them off. If you wanted to go back home, you go home, you do something for 5-10 minutes, and then you've got to turn around, go back up to Neenah. So that's, they said it would be great here, because then they can actually get stuff done at their home. So
It's a great facility that they're going to have it at.
How frequent are that being planned for, like weekly or?
They asked if they wanted us to do it daily, and so
daily.
we thought that'd be a little bit too much to bite off. So we're meeting on Monday to determine what the frequency will be. It'll be more than what the Neenah is, though. They're prepared to do a lot more than that. They really want to get this up and running and available to our community. So we
Great
decided
reason.
hopefully on Monday.
any other questions?
One of the other things that's a little bit unique about Winnebago County and was in our application for this position is really trying to look again at the generational aspect of this. So there was, like at the Neenah Respite, a baseball team who came in their uniforms and brought some old baseball cards, and the men loved going through the old baseball stuff. Having the daycare across the street come and borrow the drums from Lyric and Laughter to do music and sing to them. They loved to do the music. So having volunteers from Menasha High School at that one and from Oshkosh High Schools at the Oshkosh one, so that we can really help address not just the caregiver or possibly the adult children, but the whole family. Children shouldn't be afraid because grandma's got Alzheimer's or dementia. It should be something that people understand better and are actually engaged in helping out. So we really want to look at a lot of the generational outreach.
I want to ask you a question. Now, all of the teachers or people like you, and even in nursing homes, you give the same kind of a quality information to them, or is everything different in every place?
In every county, like the
Or every nursing home, any place. I don't care where you want to go.
Presentation.
Well, I think, all the DCS positions within the state, they kind of do similar programs, evidence-based programs and stuff like that. And we have a call-in every month that all the DCSs in Wisconsin, call into this hotline, and we kind of have like a conference to kind of go over, this is what I'm working on this month and moving that forward. And we kind of use each other's materials and kind of collaborate, and it's basically kind of like a community. We're working together, and you're not stealing from the other person. We're sharing information. That's why, like the brochures, we're not creating them from, nothing. They've already been created from the DCS 5 years ago, and it's just been, maybe we have to fix it a little bit. But yeah, similar. Nursing homes, the DCS position is not necessarily supposed to like be training in nursing homes about dementia, because what they're saying is, nursing homes should already have that training. They should already be going through that training. But if they have questions or want to collaborate, definitely we're open to give that. But they said that would be a job in itself to train every nursing home on dementia, and it's needed. It's definitely needed, but
It's nice that we do have the flexibility. When Becca talked about sharing resources, there was another county that had a pizza party for caregivers. So it was just an open event, free to come and connect with each other as caregivers and learn about, again, the resources that are available. And we're thinking about, our pizza party is the end of this month.
the 29th.
So one of the things we're hoping to get to be able to advertise at that is that with this caregiver respite being available at the church in Oshkosh, as we are approaching businesses to become dementia friendly, one of the pulls is to say we're going to have a free respite day for caregivers to go Christmas shopping. And we're going to advertise your business as one of the things when the caregivers drop their loved one off to go do their Christmas shopping, that you'll be listed as a restaurant, store, whatever, that is a partner with this program. So we're hoping to help draw people in by advertising for them, for the caregivers that would get free respite through the, so we're trying to tie some things together that are unique to what we're doing that aren't happening in other counties. So.
Okay, so
Yeah.
How much are you collaborating with the hospitals in Oshkosh?
I have reached out to case management both at Mercy and Aurora. I have not heard back. Basically, I had delivered directories, resource directories there from the ADRC, and I really had a good conversation with the case manager at Mercy, because she was there. I was up on their floor, got to meet a couple of the different case managers, kind of tell them a little blurb of the dementia care specialist position. But obviously they're busy. And at Aurora, I did not get to really meet the case manager because I had, wasn't able to get up on the floor, was able to just drop off the directories at the front desk. But I had gotten their cards and kind of reached out to hopefully be able to set up something to just kind of go in, do a presentation of, hey, this is my position, this is how I could be useful to you, especially in the ERs, because you have people who have fallen or they're wandering outside and somebody notices that they get picked up, taken to the ER. What do you do at that point? And that would be key point to hopefully give me a call, and then I could meet with the family to kind of go over what different resources there are in the Winnebago County. But yeah, I haven't had anything yet specifically.
One of the things as we're kind of laying out who we reach out to and what happens when, she's only been doing this for 4 months, but she's got a lot going on. We haven't, recognizing the importance of our medical community being part of this, we haven't prioritized that within the first 6 months because we need to have these programs available to offer. So if we're reaching out to hospitals and physicians and they're making referrals and these things aren't quite up and running yet, it's a little awkward. So now that we have the brochures and some things scheduled and stuff, now we're getting to that point where we can start doing that. But it wasn't an initial priority. Again, I recognize the importance. It wasn't an initial priority just because we didn't have a lot to offer them other than memory screens, and even that we had to get trained to first. So, but that's definitely coming soon.
Becca, do you anticipate that you'll be doing a lot of outreach with individuals in the home, kind of one-to-one? Is that with the LEAP?
Well,
for
and,
this,
and the LEAP,
or-
I probably wouldn't be so much involved with, because it's going to be volunteer
Yes,
run.
Right.
So I'm probably just going to be that on the back burner as far as, oh, hey, we had 10 more volunteers have interest in it. Can you come back in and do the training? And then I would go with the training. I might have contact with the volunteers themselves as far as, okay, what are you working on? Is it successful? Kind of
Okay.
making sure that it doesn't fall in between the cracks, that they're continuing with going out there once a week, twice, whatever that member needs. But yes, I think like the main goal for the dementia care specialist position is a lot of outreach, having maybe more public outreach and going to businesses, but also with those referrals from the ADRC. So I've already kind of been working with the INA staff within the ADRC, and they'll come up to me and say, hey, I have this case, would you be interested in sitting in on it? And I'm obviously all for it, because then I'm learning from it. And if I don't necessarily need to give any information, at least I'm learning from the experience. But I have had a few experiences where I've gone out and I've been able to give them different resources. And then the INA staff is there for support as far as if they need to do Medicaid or, help out with the different programs. But yeah, working closely with the INA staff, going out to homes when there's somebody with that dementia diagnosis that may need to know about the different resources, and maybe the caregiver needs to know about the support groups and whatnot.
One of the things we've heard from other counties is that it's hard to balance the time you spend directly with individuals and their caregivers, the community awareness aspect of it, and then just the programs, keeping all the programs running. So going into this from the very get-go, we're trying to be cognizant of that and look at how to keep these things sustainable. So the memory respite and Nina, we meet quarterly, and they just do it on their own. They schedule it, they do the programming. They're really pretty self-sufficient. The 20th Street YMCA in Oshkosh with the memory cafes has chosen to take a lead. Not to say that we won't have any contact with them or involvement, but they don't need as much help to keep that active and running. So we want to make sure that Becca has enough time to meet directly with individuals and families, but then when we divide out the community stuff, the education, and the time with families, we also have to look at our Aging and Disability Resource Center and their staff. What is their role and what is Becca's role? So that's a moving target as far as when she's engaged versus just the INA staff do it, when they both get involved. When it's simply looking for dementia resources, it probably won't even go to an INA staff. Becca will take that role. So we're trying to figure that all out, but definitely we'll be part of it.
And one other question. Do you know the participation levels at these memory cafes? I know not that many years ago, we only had one in Winnebago County.
Well, there's
There's
more than
four.
one.
there's
or yeah,
four.
or yeah. It varies.
Yeah.
When I've gone to the Menasha one, well, the last one I went to in Menasha, Elvis was there, so it was a great turnout. There was probably like 20 to 30 people there at that one, so great turnout. But before that, when I went to the Menasha one, there was maybe 2 or 3 couples, so it was very small. But it was still good. The Nina Library, every time I've gone to that one, they've had a really good turnout. The first time I went to that one, again, they had 20 some people, and even the second one, they had 4 round tables with like 8 seats of people at them. So they've had pretty good turnout. The Oshkosh Library, it's not bad. I mean, I would say there's probably like 6 couples that go to there, so a good turnout. And then same with the Y, the couple that I've gone there, they probably about the same as the Oshkosh Library, about 6 couples that turn out. But and from what I've heard, it's nicer when they're a little smaller, just because people engage a little bit more, feel a little bit more comfortable. So it's nice to have that smaller group. But yeah, I think it's just a matter of targeting what a theme they want, not planning it based off of what I think the theme should be. I've heard that that's a key thing, is asking what they want to see brought to the memory cafes. So my goal is to, what 20th on Y has started is they have a meeting right after the memory cafe, and it consists of, the lead person that runs the memory cafes, but also people who attend the memory cafes, and they sit after the memory cafe just for 5-10 minutes, and they ask, okay, the next 3 months, we're going to plan them out. What do you want to see brought here? And then they form kind of their schedule based off of what the community member wants. And that's what I'm hoping to do at the Oshkosh Library, is have a subcommittee just with the Oshkosh Library. And then we would meet as a whole with the 20th and us to say, okay, this is what we have planned, just to make sure that we're not doubling up on anything.
How active are the faith communities with doing trainings, getting more information?
I haven't had anything yet, but I really haven't kind of been out there to say it's available. With the Purple Angel and creating the brochure and kind of starting that whole process, I didn't know what was all entailed in that training and what, you really have to do for the training specifically. But I think once we start getting out and letting people know about that, I would assume they'd be on board with wanting the training. But yeah, no, I haven't done anything yet with the...
It's one of my experiences, and it goes back to one of my previous employment positions in training congregations for their pastoral care committees, care partners and stuff. A lot of the families, when the dementia starts being more of an issue, they isolate themselves from the church, from everybody. And I know in my own church, we're looking at how to better serve elders. And I think some of that training could be helpful to, be it our pastors, be it our, vestries or boards. And do we initiate it from the faith community side, or is that an outreach that you're looking at doing in the foreseeable future?
I would say maybe just reaching out specifically to me and then going and having a presentation specifically with that one church or that faith community. Because, there are going to be events and stuff that are in the future, but, that's going to be, we're hoping to have it open to everybody. Like the steering into the skid, the reason we're kind of having a hard time finding a place to have it is we don't want to have it at a senior center. We don't want to have it at a nursing home. We don't want to have it necessarily at a church, just because we want everybody to feel comfortable to attend this event. So we want it to be for your younger population and your older population. So if you're having it at a nursing home, you're not going to reach out to that younger population, unless if they have, a family member that's in the nursing home or they work in a nursing home, then obviously you're reaching out to them. But somebody that's a high school student that, doesn't have any affiliation isn't going to be like, oh yeah, I want to go to the nursing home to go to this play. Where if it's at, Myron, or we were kind of looking at UW Fox Valley, it's more, I guess,
Neutral.
yeah, a neutral area for people to attend it. So I would hope I'd have a better outcome. But we'll see once we have it and go from there. But from people that different counties that have had them in the past, they have kind of had it at a central location too, like a community center, something like that, and they've had great outcomes. So
The other thing about the faith question is that, no, we haven't reached out yet. Definitely something that's will be part of what's going to happen. I also agree with Becca that it would be nice for them to reach out to us initially. But you've heard that we're not reinventing the wheel here. There's a lot of things that we've learned from other dementia care specialists in other counties and ADRCs. So I would be interested in fact, maybe at today's call we can ask, but to see if there's any presentations that have been developed specifically for faith communities. and see if we can modify that for our county, because we don't have anything specific to them, but their needs are certainly different in terms of how do you continue to keep the person and their loved one engaged in the services. How do you, sometimes you think about churches who have like a crying room for little children so that the kids don't wander away. Well, if it's a person with dementia who tends to get up a lot and wander, they're not going to go in that room because it's a bunch of kids that are very loud. So what can a church do to help the rest of the congregation, I guess, understand that this person has dementia? We've got little cards that we hand out to, say, a waiter or waitress to say, I'm with someone with memory loss, please be
Forget-me-not
patient. Yeah.
cards.
So what could we do within a church to help the entire congregation just be more sensitive and help that person feel more comfortable continuing to attend? There might be something out there already that's targeted toward that for training or something, but we can definitely ask about that specific question
I
too.
would definitely be interested, because I'm involved with pastoral care to an extent at my church. And any professional help that I can bring in there is going to help all of us.
Well, and this church in Oshkosh reached out to us because they were very excited. They felt like they were losing that population. And so they decided that their niche was going to be providing this respite. But as a congregation, they really want to keep reaching out to that population and keep them engaged in their services. So you're not alone, I guess, when you think about that in all the different churches.
Thank you. Any other questions or anything for the ladies? Thank you, because I think you brought a lot of very good information.
Good, thank you.
Thank you.
We're also having a caregiver conference on April 1st, no fooling.
Yep.
And that's going to be for all caregivers of all sorts, but we'll certainly have some specific Alzheimer's and dementia supports at that caregiver conference.
Do you know your time frame for the Dementia Live? I know that you've been busy, but
I don't. I reached out to her. It's, they're from I think Green Bay area. They're from within Wisconsin. And, she just has to come down and train. The thing was, she doesn't want to just come down and train me specifically. It's looking at who else could we train within the ADRC that would be interested along with me, because if I'm sick or can't do the training, then there's kind of that backup person that also knows the training. And it's always nice to maybe have somebody along with you if you're having a big group that you're going to be training to. But it's just a matter of, that financial piece, finding out, a time to have them come down, do the training, and then that's really it. I mean, they give you the materials, and then it's just a matter of being able to kind of offer it up to whomever, but
I've done the virtual dementia tour, and it is very powerful and helped me understand what that individual might be going through.
Right.
And so I'm very excited that you're doing it, because I think it will enhance what you have to offer.
right.
We also want to make sure that the rest of the community knows about the regular sites for those virtual dementia tours, because there are, 2 in the county that provide it regularly?
Lake
I
Shore
know
Manor.
Lakeshore, yep,
Yeah.
they do the virtual dementia
Yeah.
tour, and then I know Valley B&A is trained in it.
So we want to
Well,
make
they
sure that
provide-
people are aware of those too, so that we'll be doing the Dementia Live, but we also want to know if, the law enforcement wants the Dementia Live or virtual dementia training now, contact we want to make sure they know
yeah.
about Lake Shore.
I know that the PD it was an article
Was
in the
going-
Oshkosh
yeah.
Herald. That was fantastic that they're getting
Yes.
that training. I think it could benefit the ERs and a lot of different.
And it's the Oshkosh
Organization.
Police Department that came up with, or got the grant for the Project Lifesaver to help track people who wander.
Oh, yeah.
And they're willing to partner with any other law enforcement in the municipalities in Winnebago County to help them access their that service through their grant. So we've got a lot of interest, that's for sure.
Just one suggestion is we work with the Oshkosh neighborhood associations a lot to try to get the word out for different things that are going on in our community, and they're a great resource to use. So,
The Oshkosh what?
neighborhood associations, especially with the cold weather coming up, and you see somebody outside, don't be afraid to go ask them.
The
what
lady
it
that's
is.
working with the associations from AdvoCap or LSS, there's a lady that's been,
Pam Reuter?
Goodwill Industries. isn't it? There's a staff person who's been kind of coordinating some stuff with the associations. I have her name back at the office. We can contact her and she can maybe help us connect with which ones are in place and, yeah.
Can you get a copy of the PDF to Bobby?
Yeah,
Some which way, right?
the
So we-
handout that
yeah.
kind of
What-
says everything.
What's your,
Oh, for the
Yeah.
PowerPoint. Yes, for sure.
yeah, right.
Even if the
PDF.
handout, even if
We've
you
already
have
done it.
PDFs of the handouts would be great.
Okay, yeah,
Some of us keep them on our computers.
okay.
In a 55 and up building, I do a fair amount of information referral. It's nice to be able to print something off quick and
Right.
a handout.
Yep, I can definitely do that.
Okay, good.
Thank you for having us.
Thank you.
Yes,
Thank
thank
you.
you.
This was good.
Okay, and we'll go on to committee reports. Strengthening our partnership with neighborhood oops. I'm sorry. You informed me. I forgot B, our meeting location for December is across the parking lot in the safety building because the elevator will not be functioning. The elevator will not be functioning in this building. So there'll be multiple reminders of that for you.
Police station, you mean, right?
Right over here.
Straight across the street.
Yeah, that's what I mean, yeah. Okay, I've never been,
Across the
Parking lot.
okay,
Okay.
thank you.
Going on, old business, strengthening our partnership with neighborhood associations and other partners. Lurton is not here, but Julie or Zandy, do you have anything from your groups?
Did you want any of the paper copies of our brochures or the pizza card, any of that stuff right now?
Would love
If
it.
you've got it.
I have some extras. There you go.
Thank you.
Okay, thank you. Improving access to affordable transportation and delivery services for seniors. Peggy Lurton? If you've been following in the paper, there's been some things coming up, and I just got just a very brief piece of information. Making the Ride Happen is really bumping up their participation in this area, looking for volunteers and being able to provide more rides for folks, as well as a new program that is in place. And we'll get more of that as it becomes available. Community design and policy that supports an age-friendly community. Gina's not here. Improving communication and visibility of available services to seniors. And Bobby, do you know how far they are, Ann and the city is with our website?
I do not.
Okay. Ron, you heard
Yeah.
any more on?
I have not heard any more on that
Okay,
topic.
okay.
Interested in knowing more, but.
All right, then we'll go on to other business.
Oh, I'm
That
sorry.
Ron, I know has got.
I did have a few others. I do have a few others. You probably have seen it in the news, but just in case you haven't, there's a new Social Security phone scam going on. The scammers are engaged in calling in a caller ID trick called spoofing, where you look at your caller ID, it looks like Social Security Administration is calling you. And the Social Security Administration is not calling you, is the bottom line. And the scammers will ask for your personal information, like your Social Security number, so that they can manage an increase in your Social Security check. Or, if you're not cooperating, a decrease in your benefits. And those are scams, and it'll look just like, though, that's the Social Security Administration's number. And it's called spoofing. The things you should do is, first of all, hang up. So, I mean, this stuff is repetitive in terms of these scam calls, but the Social Security Administration staff are not going to threaten on the phone, even if you call them. If you have any doubt about the call, certainly hang up. and then call the Social Security office's number. It is the same number. It'll be the correct number showing up on your ID, but it's not the Social Security Administration calling. They're spoofing, someone else is spoofing that number. And they also recommend that if you get a spoofed call, to report it. And you do that by contacting the Social Security Administration's Office of Inspector General, and the number is 1-800-269-0271. That's 1-800-269-0271. They also recommend you could contact the Federal Trade Commission and let them know about the spoofed call as well. Another thing related to Social Security Administration, they just announced October 11th there will be a 2.8% increase in Social Security benefits beginning January of 2019. And let's see, the other change, October 12th, the day after, the Centers for Medicare and Medicaid Services announced that the new premiums, deductibles, and co-insurances for Part A and Part B for 2019. So the standard monthly premium for Part B enrollees will increase by $1.50 to $135.50 per month, and the annual deductible will increase by $2 to $185. So a couple of changes there to be aware of. Another interesting thing is the prohibition of pharmacy gag clauses has been signed into law. On October the 10th, the Patient Right to Know Drug Prices Act was signed into law. It's federal, at the federal level, which means that it's illegal for Medicare plans and commercial insurance plans to prohibit pharmacists from informing patients that the cash price for a drug is lower than their insurance copay. In the past, that was written right into their contracts, apparently, that, you know, if you could get the drug for $2 and your copay was $7, you had to pay the $7. Well, now the pharmacist can say, for $2 you can get this medication. So that was passed October 10th. And I will hold on the other thing for next month.
Okay, thank you. Anyone else?
I just got a couple things here from Wisconsin Department of Health. Talking about, when we changed the time last Saturday, you also should be changing your smoke alarms as well as carbon monoxide detectors, check on that. And so, that's just kind of a reminder here. And that you should know the signs and symptoms of carbon monoxide poisoning. Are you aware of what the symptoms might be for that? Well, if you've ever known anybody who's experienced it, they kind of get a little dizzy, a little confused, maybe nauseated, and it can progress to the point where they actually lose coordination and pass out. So it's not a good thing, and sometimes you don't recognize it in your own home. Right. I know one time somebody came into my house and said, kind of smells like gas in here. And I go, what are you talking about? I come in here every day. I don't smell that. But you can become accustomed to it.
Yeah.
So just because this one person who didn't come to my house a lot came and said that, I had it checked out, and sure enough, I had WPS come out, and there was just a small leak there. Now, it was minute, but that could build up over time and be a problem. So it's just something to be aware of, and you should have a carbon monoxide, detector, as well as, fire detectors, smoke and fire. The other thing that they talked about here is for the first time in over 50 years, Wisconsin had a case of St. Louis encephalitis, which is a virus, and it's transmitted the same way as West Nile, through a mosquito bite. Now, we don't have to worry about mosquito bites anymore, but that is really rare to not have a case of that in over 50 years.
Oh.
So that was just kind of remarkable. You just get kind of the same kind of symptoms: fever, headache, nausea, fatigue, and usually that's it. But some older people who have other problems to begin with, they can really be affected. So just something to be aware of.
Anyone else? Deb, you haven't been here for a while. Do you have anything to share with us?
You said that the last time, and I've been here. No, it's just obviously been very busy with city budget and things like that, but I've been staying very close to what's going on in this committee. And I just was thinking just a minute ago of how far the committee's come just in the last year or so. It makes me really, really warms my heart, and it's really neat to see the members that have joined, and then also the information that's being shared. I have heard from the community that has seen the messaging that's been on through the programming, that it's great information and is definitely something that our population that's improving and has more wisdom than, say, somebody like myself is benefiting greatly from.
Thank you. I didn't mean to infer anything other, because we have others that don't make every meeting. And it's really great to have someone from the council coming to our meetings, that particular input that reflects the larger community, and to be able to share back and forth. And you certainly went through that difficult process with us last year. So
You know what? Growth opportunities.
It
That's what I
is.
like to call them. Growth
It is.
opportunities.
It is. Which kind of leads me into a couple of things. Before I forget it, the Senior Expo last month, there was a good turnout. We were fortunate to have our own space for the Committee on Aging for a display. Ron and I met a lot of really neat people. His chocolate drew them in. But it gave us a chance to explain a bit more what we're doing, and where we hope to be. No, we can't resolve their rental issues with their landlords and things like that, but kind of referring them on to where they can. But it was a good experience.
It was good. A
Very
lot of
good
people
experience.
stopped by. Yeah. I
Okay.
think that a lot of people didn't know that there was an Oshkosh Committee on Aging. So it was an opportunity to talk with them a little bit about who we are and what we do. We had a nice poster and little quarter sheet handouts that they all got, so.
Right. And our poster was basically the same information that was on that handout I gave you last month. And it took the key points of the strategic plan, and we could point out, this is areas that we're trying to work on, this is where we need help. Can you help us? Or do you know somebody that can? Usually that question about can you help us, they backed away. But there were good comments, and we felt very encouraged by it, I think. The other thing is, back in 2012, and there's a couple of folks that are still around from that particular period of time, there was a strategic plan done with Dale Feinauer from the university. And what I would like to do this month is have that sent out to everybody. Look at that, compare it to the strategic plan we did last year, and then communicate with the rest of your committee, whatever committee you've been working with, and compare between the two and to where we are, and some suggestions that you would like to see going forward from this point. Because we're a year out from the last one. And what goals did you meet? What didn't you meet? What changes need to be done so we can continue to move forward? Because I think we are making great progress. So, any suggestions right now that you would like to have us address, or would you want to think about it a bit more? Okay, anyone else have anything? All right, our next meeting will be December 4th, as we said, over in the safety building. And in 2019, there will be another senior expo. It'll be the first Tuesday, so it'll be our meeting day. We'll do an abbreviated meeting that day, because we will probably have our own booth again this time, or that time. Okay. I'll take a motion to adjourn.
So move.
Second?
A second.
Okay, all those in favor?
Aye.
Meeting adjourned. See you next month.